To today's webinar, Safe Home, Safe Workplace, Understanding Chemical Hazards and Infection Control in Home Healthcare. My name is Shondell Day. I am with the Education Department at AFSCME International. I will be your host for today's session. Before we begin, I would like to go over a few housekeeping notes to help improve your participation with today's webinar. Please select Use Telephone after joining the webinar and call in using the numbers provided once you sign on. Be sure to use the audio pin shown after joining the webinar. On this slide, you will see a panel. This is the attendee panel. That orange tab with the arrow will open and close your panel for you. The next section you see is the audio section. If you do not have a built-in microphone or a plug-in microphone, please select Use Telephone and dial in using the numbers provided to you. This next slide will show you where the question queue is. It is located right there next to the hand icon, which you will use to raise your hand to be unmuted for verbal questions. In order to do this, you must have dialed into the conference and entered your audio pin. If you have a built-in microphone into your PC, then you will be fine. I want to also please let you know to please take the post-evaluation at the exit of this webinar to receive a certificate of participation. You will be sent a certificate by the end of the business week. Please be reminded that this session will be recorded. I am now going to turn the session over to your presenter for today's webinar, Diane Matthew Brown.
Good afternoon, everybody. My name is Diane Matthew Brown. I'm a Health and Safety Specialist in the Department of Research and Collective Bargaining Services, and this presentation is from AFSCME's Training and Education Institute. Today's webinar, Safe Home, Safe Workplace, Understanding Chemical Hazards and Infection Control in Home Healthcare, is going to be one of 3 topics in a webinar series that we will be doing for home healthcare. The other 2 webinars will be on safe patient handling and ergonomics and on workplace violence. We hope that you will also join these future webinars. I have a couple of disclaimers. The first disclaimer is that this material is being produced under a Susan Harwood grant, number SH276355, through the Occupational Safety and Health Administration, U.S. Department of Labor. It does not necessarily reflect the views or policies of the Department of Labor, nor does it mention of trade names, commercial products, or organizations imply endorsement by the U.S. government. Secondly, this AFSCME Training and Education Institute ATEI presentation is intended strictly for the educational purposes for attendees. It is not intended to provide medical advice or diagnosis. All images are property of AFSCME in the public domain from a public website or are credited. With that, let's review our learning goals. We'll be discovering common chemical hazards, understand how chemicals get into the body and the potential health effects, how diseases spread and how to best protect yourself and your clients, and to develop action plans to make each home safer for both you and the client. Let's do a quick poll and see who we have online. How long have you been a provider? Wow, we have some good experience in the room. We have some folks with more than 15 years experience. It's wonderful. All right, we're going to start off with hazardous chemicals. So what makes a chemical hazardous in the first place? Let's review a few things. A chemical is considered hazardous when it has at least one of these 4 properties. Fire, the product gives off enough vapors at a low temperature that when exposed to heat or an ignition source, it will catch fire easily and burn. Poisonous or toxic, has serious health effects, including death. Corrosive, this product can burn skin, eyes, and goes through metal. And reactivity, reacts with other chemicals or organics to produce a reaction, often giving off heat or toxic vapors. Please be aware that many chemicals have more than one hazardous property. What types of hazardous chemicals are found in the home? We have to look at the home as a workplace. What are common chemicals found in the home that could cause you injuries? Please put your responses in the chat area, and don't forget about places like the bathroom and the kitchen. Okay, so most homes do have hazardous chemicals, and many are found in cleaners, detergents, glues, flea and tick controllers, paints and paint thinners. These all have hazardous properties. Fire, combustion hazards, reactivity hazards, health hazards including toxicity and corrosiveness. A safety data sheet may be available from the manufacturer. Know what chemicals are present in the homes that you're working in and make an inventory. A safety data sheet is a chemical fact sheet from the manufacturer itself. These can be gotten from your agency if you're working with an agency, or if these things are being purchased, they may be available from places like Home Depot or from the chemical manufacturer's website. Pictograms. Okay, pictograms are meant to provide quick and easy information about the properties of a chemical. They're now required for all commercial products, and you may begin to see these pictograms on consumer products as well. From left to right, starting with the exploding bomb all the way at the top. Exploding bomb includes all explosives, including dynamite and gunpowder. The flame symbol, that's the flame with the bar at the bottom, includes all flammables, gasolines, alcohol, solvents, and acetone. The flame over circle is for oxidizers. These are very reactive chemicals often used in industry and in disinfectants, such as hydrogen peroxide. They can be very dangerous in fire situations. The gas cylinder are gases under pressure. The corrosion symbol is the one right in the middle. That's a hand and a bar of steel in the pictogram. These are products that can burn through flesh and metals. They are either very strong acids or bases, otherwise known as alkalis. Both ammonia and bleach are very corrosive. The skull and crossbones all the way over to the right are acute poisons that can be fatal. Down at the bottom and to the left is our exclamation mark. These are products that are harmful, not fatal, and tend to be irritants to the skin, eyes, or respiratory system. The exploding chest is dangerous to health that reflects long-term health effects such as cancer or birth defects. And last but not least is our environmental symbol. That's a dead tree and a dead fish. And these are products that are dangerous to aquatic life, not to be dumped into the waterways or into storm sewers. All right, so take a good look at those pictograms one last time, and we're going to test your memory. Take a look at this first pictogram and select the best answer for the definition. Ooh, great. Everyone got it. Those are harmful, not fatal, irritants to the skin, eyes, or respiratory system. All right, how about this next one? Very good. Flammable includes gasoline, alcohol, solvents, and acetones. And last but not least, that's correct. These are acute poisons that can be fatal. Everyone did great. We're going to go on next to how chemicals enter the body. There are 4 routes of entry or ways chemicals can get into the body. These are skin absorption through contact, ingestion through eating and drinking, inhalation or breathing it in, and injection, a puncture or break through the skin. Health effects can be both acute or short-term or chronic, long-term. Common example is ethyl alcohol. Ethyl alcohol is the main ingredient in drinking alcohol, beer, wine, liquor, etc. We all know some of the short-term health effects of exposure to drinking alcohol. Does anybody have an example? You can type your responses into the question area. Some symptoms of overexposure could be dizziness, nausea, lack of coordination, and slurred speech. We also know about some of the long-term health effects of drinking alcohol. These examples can be liver disease, cirrhosis of the liver cancers, stomach cancers, kidney disorders, and neurological problems. The biggest difference is we choose to drink ethyl alcohol in the form of wine, beer, or other alcoholic drink, and the route of entry is ingestion. However, you should know that ethyl alcohol is often an active ingredient in some cleaners and solvents. If absorbed through the skin or by inhaling the mist when sprayed, you could be exposed to ethyl alcohol and even experience some of the same acute health effects. Always look for the active ingredients on every product label and note directions for use and the listed health effects. Next couple of slides are going to talk about chemical guidelines for safe use. Always want to use the least amount of the product to get the job done. Soap and water remove most germs and dirt from surfaces. You must clean the surface before you can disinfect it. Use the least amount of product to get the job done. More is not always better. If using household bleach as your major disinfectant, the dilution of 1 part bleach for 10 part water is what is for use for blood, stool, and vomitus. And 1 part bleach to 20 parts water is what's used for general disinfection. Continuing with some safety guidelines, always read the label thoroughly and look for dilution and proper use, the hazard warnings, including health hazards, and the proper personal protective equipment that is needed for use of this product. Always use chemicals with proper ventilation and avoid direct contact with any product. Never smoke while using household chemicals and cleaning products. If you feel dizzy, nauseous, or suffer headaches when using the products, stop immediately and move to fresh air. If the symptoms do not improve, seek medical attention. Be aware of any pesticides such as Raid products, flea and tick products, or herbicides such as Roundup or the ones used by Lawn Doctor. Do not use pesticides or herbicides near any food or eating utensils. An additional note of caution with pesticides. Flea and tick pesticides used in collars or applicators for pets can also be harmful to the elderly or the very young. The thinner skin allows some of the pesticide to enter the bloodstream. Read the instructions carefully, always use with gloves, and keep all pesticides out of the reach of children. Never mixing cleaning products. Especially with bleach, bleach is very reactive, toxic, and corrosive. Household bleach should never be mixed with anything but water. Mixing bleach with ammonia-based products can cause the formation of chloramine gas, which is toxic. asthma, burning of the throat and eyes, and serious lung irritation can occur. Additionally, many products are made with bleach. Again, these products should not be mixed with or applied with any other cleaning chemical. Sometimes chemicals can get accidentally mixed in the pipes when they're being poured down the drain. Always flush with cold water between and after pouring them down the drain. The best way not to be overexposed to chemicals is not to use hazardous products to begin with. So when we say a product is green, it means the product will break down safely in the environment. These products tend to have less harsh properties. Again, read the label and directions for use. Avoid strong scents. Remember, clean doesn't have an odor. Avoid products that contain bleach and ammonia products as their active ingredients. Use products that are third-party certified. We'll go over that in the next slide. Some products that include hand soaps, paper products, specifically ones using recycled content for facial tissue, toilet paper rolls, and paper towels. Paints that are low volatile organic compounds, known as low VOC. This means that the less harmful vapors come off the paint that could be inhaled. Knowing whether it's green, third-party certification. Look for these certification logos to ensure that you're truly getting a green product. These include safer disinfectants, wall and ceiling paints, computer equipment, office supplies, and furnishings. So the smart marks, the eco logo certifications there are used for things like light bulbs and computer equipment. The green seal, you'll find that a lot on cleaning products, paper products, and the CRI green label is for carpetings and furnishings. Tools for use. Consider using microfibers for your general dusting and mopping. They require little or no chemicals to remove the dust and dirt and make it a lot easier to use your disinfectants. Proper storage and disposal. Always store products in their original containers and make sure you can read the label. Store like with like. Like chemicals should be stored together, and keep bleach-based products away from everything else. Flammables, combustibles, and aerosols should be kept away from heat sources and reactive chemicals. The storage area should stay secure. And again, remember, not all chemicals are meant to be poured down a drain or even put out in the trash. Participate in household hazardous waste collection days. If your local jurisdiction doesn't offer these days, see if they offer a household hazardous waste site where you can drop items off. Just like a patient care plan, providers should develop a chemical action plan, and these include preventing the dust and dirt from getting in to begin with. Find ways to use mats to help prevent dirt from getting into the home. Entryway mats can reduce dirt up to 85%, resulting in cost savings in cleaning products and time savings as well. Inventory the chemicals in your home. Know which chemicals you have on hand, and if your client has any sensitivities to these chemicals. Ensure proper and secure storage. Make sure the lids are on tight and that they are secure. Use gloves and any other personal protective equipment as indicated on the label, and make sure this personal protective equipment is within reach. So we're going to have a quick check on learning for the section on chemicals. Couple of questions. Please select the best answer. A property that defines chemical as hazardous includes, and please select the best answer. All the above, great. Everyone got that one right? Our next question. Name the 4 ways that chemicals can get into the body called routes of entry. And everyone got that one right. And last but not least, our last question. Water is the only product that should be mixed with household bleach. True or false? And everyone got that one, and that is true. Great. We're going to move on to preventing disease transmission. Preventing germs and disease from spreading includes the use of standard precautions. These include things like hand washing, good environmental cleaning practices, and vaccination. How diseases are transmitted. There are pathogens, we often call them germs, get into our bodies by inhalation, breathing it in, contact by touching of the skin, eyes, or mouth, or a surface and then touching the mouth, skin, or eyes, or ingestion, eating or drinking contaminated food or water. And some pathogens are transmitted through the blood and mucous membranes. Pathogens include viruses, bacteria, funguses, and parasites. Viruses include influenza and hepatitis. Tuberculosis and staph infections are example bacteria. Funguses include athlete's foot or ringworm. And for parasites, lice and tapeworm. What do you think about this slide? How would pathogens be spread in this scenario? Take a moment and type your answer into the question queue. That's right, breathing in the droplets or touching a surface the droplets fall on and then touching eyes, nose, or mouth. This is how colds, influenzas, and many other respiratory illnesses are spread. Always cover your cough and sneezes with a tissue and throw it away, and then wash your hands. Alternatively, cough or sneeze into your elbow and do not use your hands. I want to quickly talk a little bit about bloodborne pathogens. Bloodborne pathogens can only be spread through direct contact through the blood and mucous membranes. The mucous membrane is the pink skin which around the eyes, inside the nose, inside the mouth, inside the anus, and the vaginal areas. Bloodborne pathogens such as hepatitis B, C, and HIV can be found in the following blood-body fluids. Blood, of course, also semen, vaginal secretions, the fluid around the spine, the lung, the heart, amniotic fluid around babies, and synovial fluids in our joints. In breast milk, such as hepatitis B and Ebola, can be spread through breast milk. Saliva from dental procedures, because when the dentist works on our teeth, there's always blood involved. And then there's a catch-all, any body fluid visibly contaminated with blood. So regardless of the pathogen, we are going to practice infection control. This includes vaccination. Make sure all your vaccinations are up to date, including influenza, pertussis or whooping cough, and your hepatitis B. That's a 3-shot series. Check with your physician if you have any questions about the immunizations you should receive or if you need a booster shot. Practice good hand washing technique, which we will cover in more detail in the next slide. Always use gloves when dealing with blood and body fluids. Remove them promptly to prevent cross-contamination. And follow the bloodborne pathogen standard. The standard is found at 29 CFR 1910-1030, and we have a fact sheet included that you can download that explains the bloodborne pathogen standard. The standard was effective in 1992 and was revised in 2001, and it covers all occupational exposure to blood and otherwise potentially infectious materials. So I hope you will download that fact sheet and hope it will be useful to you. So let's review hand washing technique. It's one of our most important work practice controls. It's our first defense in infection control and one that we have complete control of. Hand washing facilities should be accessible, and if not, use a substitute until soap and water is available. How long should hands be washed? Type your answer in the question area. We got some answers in here. Very good. We're going to say at least 30 seconds or as long as it takes to say or sing the ABCs. So we're going to review the steps to good hand washing technique. Palm to palm, between the fingers, back of the hands, base of the thumbs, back of the fingers, the fingernails. If we're not using a nail brush, use your palm to create fiction as shown as picture number 6. Up the wrists, and then we're going to rinse well and wipe dry. And if we're using a paper towel, we'll use that paper towel to turn off the sink if it's not automated. Or turn off the faucet if it's not automated. Our next slide talks about standard precautions and a little bit about personal protective equipment. Standard precautions means that we assume that all persons are infectious, and we're going to provide a barrier between yourself and their blood and body fluids. This includes secretions and excretions except for sweat, non-intact skin, wounds, and skin abrasions, and again, those mucous membranes. Remember, this is the pink skin inside the eyes, nose, mouth, anus, and vaginal areas. Standard precautions also includes hand washing, which we just reviewed, the use of good personal protective equipment such as gloves, eye and face protection, and a gown, and environmental control. This includes cleaning not only of surfaces, but linens and patient care equipment. Be cautious not to touch soiled linens with bare hands or skin. In our next slide, we have a short video on glove removal. If anyone has any questions after the video, please let us know.
Hello, and welcome to the 456 EMS show for the awake, alert, and disoriented.
Proper glove removal. Follow these steps to prevent the spread of pathogens. Pinch the first glove at the wrist and pull down, touching only the outside of the glove. Ball up the removed glove in the palm of your gloved hand. Slide an ungloved finger inside the other glove, touching only the inside with your ungloved finger. Peel the second glove off inside out, trapping it in your palm. Discard the balled up gloves in the proper receptacle. Clean your hands with soap and water or alcohol-based cleaner.
Anybody have any questions about the video? Okay, great. Our next slide is going to talk about gloves and latex allergy. Latex allergy is a reaction to the proteins in natural latex rubber. Symptoms can include itchy, irritated skin, runny nose, itchy eyes, wheezing, coughing, difficulty breathing. Occasionally, latex allergy can cause anaphylactic shock, which is a life-threatening condition. Use non-latex products whenever possible. If you must use latex, use powder-free gloves or low-protein gloves, or use a cotton or synthetic glove liner. Wash hands thoroughly with a mild soap after removing gloves. And know the allergy status of the persons in your care. Even the powder from these gloves can carry enough proteins to trigger a reaction. Providers can become allergic over the course of time. It builds up over time. So even if you're not allergic or sensitive today, if you continue to use latex, you could become sensitive. One other note of caution. If using sodium hypochlorite or bleach-based products as your main disinfectant, latex gloves do not provide protection. The chemical will dissolve the glove. Use vinyl or a nitrile glove when using bleach. All right, our next slide talks about sharp safety. If you're providing injections, a safe needle device is required. Never resheath a needle. That's how most needle sticks occur. Healthcare providers should always don gloves before giving injections, removing or inserting catheters, or working with IV lines. Used needles must be placed in a sharp container. Never throw them out in the trash. You could accidentally needle stick someone removing or taking your trash from the home. Emergency needle stick information. The source content is the National Institute for Occupational Safety and Health. If you experience a needle stick or sharp injury or were exposed to blood or other body fluid of a patient during the course of your work, immediately follow these steps. Wash the needle stick and cuts with soap and water. Flush splashes to the nose, mouth, or skin with water. Irrigate eyes with clean water, saline, or sterile irrigants. Report the incident to your supervisor and immediately seek medical treatment. They will determine if you should take post-exposure prophylaxis and for how long. For more information, please go to OSHA.gov or click on the link here. All right, so in this last section, our check on learning, we have a couple of questions. They're all true and false. An example of a viral infection is influenza, true or false? Very good, everyone got that right. Our second question is, you don't need to wash your hands if you use gloves, true or false? Very good, everyone got that right. And last but not least, blood is the only body fluid we need to be concerned about, true or false? And everyone got that one right, terrific. Thank you so much for doing those for us. So some helpful resources. The information on the emergency needle stick information, there is a direct link to that. And then we've included a couple of resources with this webinar, but if you would like more information, AFSCME has a health and safety fact sheet section on the website, and that's the link to it. We also have additional information on like hepatitis C or many other topic areas. If you'd like more information about anything in this presentation, feel free to email me, and I'll be glad to get back to you. My email is dbrown@afscme.org. And finally, if anyone have any questions,
Hello, everyone. You have reached the Q&A portion of the webinar, so please use the hand icon to indicate that you have a question or comment, and I will unmute your microphone so that we can answer your questions. This is your time to ask any questions. The floor is yours. Just raise your hand. You could just click on that hand icon. If you see it on your attendee panel, just click on that. I will unmute your mic, and you can ask Diane your question. Hi, Mark. Your mic is unmuted.
Okay, I was just curious if you needed any more information to know that I was linked up. But apparently you don't.
We got you. We got you.
All right. Okay. Thank you. Hey,
Thank
good,
you.
good presentation, by the way.
Thank you.
Does anyone else have a question or comment? We'd love to hear from you all. Okay, maybe some of you are just thinking about the questions you want to ask. If that's the case, you'll notice on your panel there's a handouts tab. You can click on that tab and download those two handouts. One is on bloodborne pathogens, and the other is
Room-by-room checklist to help you do a safety audit of the homes that you're going into.
and those are available for immediate download. You can just click on those two documents and download them right now. But we would love to take some questions. Mark, did you have another question for us?
Yes, I'm trying to find the icon I'm supposed to click on to download those.
Do you see where it says? Do you see where it says handouts?
I do not. Should I wait a minute? My control panel keeps shrinking. Shrinking. Oh, handouts. Right. Okay, handouts too. Okay.
Yes.
Undock pane from control. Okay, call you back. Okay.
Okay.
Oops. Oh shit. Okay.
Okay.
I just double click on them or click on them and
yeah, you just double click on them and they'll download.
Okay.
Okay.
Thank you.
You're welcome. Raya, your mic is unmuted. Is that Raya or Ria? Hello, Raya. If you're using your computer's mic as speaker, if you do not have a built-in microphone, we won't be able to hear you. You can type your question into the question queue. We'll answer your question.
It's okay now.
Okay.
Oh, she said she couldn't find the download.
Okay. All right. You have it now? All right, great. Anyone else have any questions? How about comments? Okay, if no questions or comments, we're going to move on. So this bringing us to the end of our webinar. But again, I want to bring up the archive, the video archive for classes that were previously held. Let's see another question. Thank you, Alicia. We will. This is one of 3 classes that we're doing online. The other 2 classes are
safe patient handling and ergonomics, and then we're going to do one on workplace violence, and they'll be in this probably by spring and summer of 2016. We're also going to do these in Spanish as well, and we're hoping to do this one in Spanish January or February. So we will also take this program, will be in the archives
probably in 2 weeks.
In 2 weeks. So if you know someone who wanted to be on and couldn't be, they can click on the archive and they can get the same program. We just don't have the ability to ask questions.
So thank you. Let's see if anyone else has any questions. You can still ask your questions. Okay, but you can also go to the video archive to look at any of the previously recorded classes. Just going to www.afscme.org/video, and you'll have full access to the video archive. So I want to thank you all for attending today's webinar. Please be sure to complete the post-evaluation survey to receive your certificate of participation by the end of the business week. I want to give a special thanks to our presenter, Diane Matthew Brown, who is an expert on all things health and safety.
Not expert, brothers and sisters, not expert, but I hope you enjoyed the webinar.
So thank you all.
Have a good afternoon, everyone.